Jill Zapien. She's the Associate Dean for Community Programs at the Arizona College of Public Health. In 1964, she got her BA in Sociology and Anthropology at Antioch College. She is fluent in Spanish and lived and worked in Mexico for more than 20 years.
She received the Henry and Phyllis Koffler Award for Outstanding Accomplishments in Public Service and Outreach. Ms. Zapien is the first recipient of the Koffler Prize in the area of public service and outreach.
Jill's involvement with the promotoras began when she became aware about the poor health care of the migrant workers in the border areas, more specifically in Yuma, Arizona. She and other colleagues established Health Start, the first promotora outreach program in Arizona focusing on prenatal care for farm worker women. The women of the families often found it difficult to receive health care in a hospital setting. This was primarily due to the racism they encountered from some of the staff members. The women had some type of knowledge about health, but with the help of Health Start, these women were further educated. After being trained for 13 weeks, the women were qualified to serve their community as promotoras. Jill stated that everybody came to these training sessions and that the women were very thankful that someone had finally taken the time to give them the physiological explanations behind prenatal care.
Her research includes conducting the Primary Health Care Review and the Ambos Nogales Primary Health Care Project, which were collaborative initiatives with 5 U.S. and Mexican research institutions as well as with the Pan American Health Organization. Other research has focused on the implementation of community-based studies looking at prevalence and risk factors for a variety of public health concerns, such as substance abuse, cancer, lupus, and diabetes. Mr. Zapien has served as the facilitator for 2 large binational research initiatives on diabetes and cancers involving participants from academic institutions, public health organizations, and private providers. As co-investigator of the Southwest Center for Community Health Promotion, the Border Health Strategic Initiative, and the REACH 2010 project, she works directly with border communities to develop strategies for prevention and control of chronic disease.
A common competing community viewpoint is unrealistic expectations from the community to find an immediate resolution. As we all know, research can take years, so managing the expectations of a community can be a challenging task for a public health leader.
The number one barrier or challenge that Jill mentioned was funding. Most of Jill's work requires funding by means of grants. She had trouble figuring out ways of how to continue funding when there is no more money left. One of the biggest reasons behind this was due to the fact that most foundations do not wish to spend money in other countries.
The most effective leadership approach that Jill Zapien uses is collaborative. She uses supportive and inclusive methods to ensure that those she represents are part of the change process. After interviewing Jill, we noticed that she uses the 6 practices of collaborative leadership very effectively. More specifically, she is able to build trust with the community she is working with and self-reflect by understanding her own values, attitudes, and behaviors. She finds it necessary to collaborate because of the ability for a group to combine their resources and provide a more diverse and effective way to combat the problem.
Some of the key qualities Jill has as a public leader is that she is bilingual and an excellent public speaker. But the quality of most importance to her is being committed to what you're doing. An example of her commitment is seen in this quote we took from her. "Just because funding goes away, I don't get to go away." This shows her involvement with the people, as she can't just leave because she has already built a strong relationship with them.